State of Affairs welcomes Stephanie Hunsinger, who is State Director, AARP, which stands for?
Well, it used to stand for the American Association of Retired People.
After
but
the rebranding.
It's just AARP.
I love it. People know what it is.
Yeah.
Listen, I got
you got your card?
No, thank you very much.
Yeah. You should be proud.
Yeah, well, half. So, but I'm proud of the work you and your organization do.
Yes.
Let's do this. Let's jump into a few issues. The population you represent, talk about them.
So we represent the 50-plus across the country, just over 38 million members across the United States. In New Jersey, we have 1.3 million members, but as our motto says, what we do for all. So we really represent the entire 50-plus population. But we also know that what we're doing for the 50-plus today is beneficial and will affect generations to come. So we really do believe that what we do is for all.
Let's break down some issues you and I were talking about right before we got on the air. If the Affordable Care Act is in fact repealed, I mean, listen, there's been so many attempts. If it were to happen, Obamacare, what do you think it would mean for the population you represent, your members?
It would be terrible for the population that we represent. You know, AARP supports the critical aspects of the Affordable Care Act that are really important health priorities for Americans that are 50-plus. So things like providing access to affordable, quality coverage, discrimination based on age and pre-existing conditions. That's a huge issue for our members. You know, as individuals get older, they could be charged more. The provisions in the ACA, so right now there's a rate of about 1 to 3, and as you age, you can be charged higher. As you get older, you may have more illnesses, chronic illnesses, so insurance companies are higher risk, so they'll charge more for an aging population. ACA keeps that at a reasonable level. Without the provisions through the ACA, that can change.
But Stephanie, the Governor Murphy is saying in New Jersey, hey, listen, we'll take care of it. We'll set up our own exchange. We'll be good. You say?
So New Jersey has some really great laws currently that protect individuals from age discrimination, pre-existing condition clauses, providing affordable coverage.
Is it enough?
It's enough for individuals
if it were to be,
that have...
Sorry for interrupting.
Yeah.
If the ACA were to be repealed, is what New Jersey doing enough?
A lot of what New Jersey has in place is covered through the ACA. Could we do more? I'm sure we could. We always could do better in really providing affordable access to individuals. More importantly, how can we work to lower prescription costs?
Yeah, can we talk about that? How serious a problem is prescription drug costs for your members?
It's a problem. On average, individuals who are on Medicare over the age of 65 take around 4.5 different medications on a monthly basis. They are extraordinarily expensive. Yes. People are in positions where they're choosing between taking the medication that they need to stay healthy and buying their groceries or paying their electric bill or paying rent or mortgage. No one should ever be in that position. Our costs are exorbitant. And we need to do something to change that. We need to do that. Congress needs to do something to change that.
Who's the leader on this? I heard Senator Booker and Senator Menendez talking about it. Are they leaders in this effort?
They're champions on this, and we'll continue to work with them and trying to get them to push this and do everything that they can to help lowering the costs.
Do you think the industry, the pharmaceutical industry, as a group, are listening and understanding how serious this problem is for those who are 50-plus?
I think they're listening. I'm not sure if they're understanding it. So our job is to make sure that we keep getting that message out there and making sure that everybody understands that, not just Congress, not just constituents, but the pharmaceutical companies as well. And we're not asking them to change the work that we're doing, not asking them to decrease research. What we're asking them to do is think about where they're spending their money and pass some cost savings on to consumers. Americans pay more for the prescription drug coverage and costs than pretty much any other European country does. And that's a problem.
We're #1, and that's not good.
It's not good.
Can we talk about this initiative? I'm curious about this. The New Jersey Secure Choice Savings Program passed March 28, 2019. What is it?
Yeah. So it is a private-public partnership where it provides a vehicle for individuals. 53% of New Jersey residents had no way to save for retirement through their employer. And so this sets up a private-public partnership where workers who didn't have access to saving for retirement now can. It is a auto deduction. So instead of
opting... What does that mean?
So instead, normally you would opt in to a 401k at your employer. This isn't automatic, so you have to opt out of participating. So when you start working for that employer and you sign up to be a part of this program, you will automatically have a percentage of your salary that will be put into a savings retirement plan for you.
You know, some of us are obsessed by trying to save for our kids to go to school.
Yeah. Yeah.
Hard to do. But what about the whole question of saving for retirement?
Yeah, so, right now, on average, the average American has about $14,500 saved for retirement. $14,500.
That's the average.
That's the average. In New Jersey, the average Social Security check that residents receive is around $19,000. So people are relying solely on Social Security.
$19,000?
$19,000 a year. A year they're getting, $19,000 a year. And people are relying solely on their Social Security as their retirement. And that is not what Social Security was meant to be.
So what do you say to your members? What do you say to them? What's the message to your members about this? Because they're trying to get through every month.
Yeah.
But they got to think about the future.
So Assemblyman Freeman was a sponsor of this legislation, and recently at the bill signing, he made this analogy, and I thought it was such a great analogy. He said he remembered when he was a kid, his dad would come home and he'd have change in his pocket, and he would take his change out and he would put it in like a jar or a bucket in their house. After a while, that little bit of change, you don't even realize it's missing, but after a while, it all adds up. And this is what the Secure Choice Savings Program is about. It's about taking a little bit now and putting it away without even realizing that it's gone. And then in time, that adds up so that you end up being in a position where you can live comfortably in retirement. You can stay in your home and in your community and with your family where you want to be, and not be in a position where you're forced to have to relocate because you can't afford to stay where you are.
Before I let you go, this is Stephanie Hunsinger, who is State Director of AARP New Jersey. Social Security. How secure?
I think that we are, it's going to be a fight, and we're going to continue to have to fight to protect Social Security. It may not be the only means of savings, but it is an important means of savings for, as I just said, many Americans who are relying solely on that for their retirement. We have to do everything we can to protect that and make sure that it's there. They've been working for years and paying into the system with the idea that it's going to be there for them when they need it, and we need to ensure that it is.
And anyone says we need to balance the budget by making some cuts on Social Security, raising this age, that you say?
I say no. Making cuts to those changes ends up not only hurting the individual, but it hurts us as a country as well. It ends up costing more money in the long run. It's the same thing with the ACA. When you provide individuals with assistance that they need, Social Security, adequate, affordable health coverage, you don't have individuals who are running to the emergency room. You don't have individuals that are coming to the government to ask for assistance.
Stephanie, it's the first time you join us. Don't let it be the last.
I hope not. Thanks for having me.
Thanks for being here. I'm Steve Adubato. Thanks for watching this edition of State of Affairs. So let's continue the conversation. So follow me on Twitter at Steve Adubato. Promise I'll see you next time. Take care.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation, celebrating over 30 years of broadcast excellence. Funding for this edition of State of Affairs with Steve Adubato has been provided by the Turrell Fund, supporting Right from the Start NJ, Holy Name Medical Center, This Place is Different, NJM Insurance Group, Wells Fargo, New Jersey Resources, the New Jersey Education Association, and by Summit Medical Group,